To speak a little about what we are doing and why we are here. Public Health Foundation of India started its work in 2006. I used to be the head of cardiology in the All India Institute of Medical Sciences, and many people wondered why I have left when I still had 10 years of service to come to the Public Health Foundation of India. That's because I felt and clearly recognized that India was not being well served in terms of its health because of weaknesses of the health system and lack of public health expertise. And all the investments, limited as they were, in health, in terms of public financing or even private financing, were not yielding optimal results because we did not have sufficient public health expertise. Public health expertise is needed right from guiding policy development with the right kind of data on what the health problems are and how best they can be prevented, but also to program design, delivery, monitoring and evaluation. All of that requires public health expertise, which is multidisciplinary. While we do require medical expertise for providing health care, we require many other disciplines to bring the breadth of knowledge from life sciences, from social sciences, from quantitative sciences like epidemiology, biostatistics and demography, from management sciences, including health technologies, health economics. All of that is going to be very important. And we did not have institutions like that in India. Surprising, because the first schools of public health started in the Europe and United States several years ago. The London School of Hygiene and Tropical Medicine is 130 years old. Johns Hopkins and others are about 110 years old. And even in our own region, Thailand has had excellent schools of public health. And Bangladesh has had, for some decades, now the BRAC School of Public Health, which has actually helped to transform the health indicators of Bangladesh to the extent that now Bangladesh has higher life expectancy than India. Many other health indicators are better in Bangladesh than in India. Indeed, even Nepal has a higher life expectancy. Now the question is, despite our economic growth, which is very salutary, we have not achieved the level of gains in health that we should have had. In terms of human resource indicators, we are 158 among 196 countries. That does not speak well of overall India's health system. We do have islands of excellence in clinical care, of which we can be proud of. But if our infant mortality rate is higher than that of Nepal and Bangladesh, and possibly 5 times higher than that of Sri Lanka, then there is something that is missing in our overall health system, and that is public health expertise. That is why we wanted to bring together all of this kind of multidisciplinary expertise for multi-sectoral action in order to try and transform India's health system, right from promoting health as a positive element in the population, not just illness care, but also prevention of disease, early detection of disease, and then trying to provide cost-effective care in a timely fashion. And then provide, of course, the systems which can deliver rehabilitation and palliation as required, the entire breadth of health services which need to be available. Now people ask, what is the difference between public health and clinical medicine? Clinical medicine delivers health in retail. Public health delivers health in wholesale. We are dealing with population as a unit, and that is how we have to really influence the determinants of health at that level. And even if you take the whole continuum of health, Even if you take a person who is diseased and is meeting a nurse or a doctor in a clinic, where did that person come from? Why did that person get diseased? Could that have been prevented? Could that have been detected much earlier rather than at a late stage? Are the clinics and hospitals themselves adequately staffed with the right kind of staff who are in numbers, skills, and teamwork? And when the person leaves that healthcare facility, what is the kind of service available for follow-up, rehabilitation, palliation? Are drugs which are needed affordable, available? All of those issues come up under public health, because public health identifies and influences the determinants of health at the population level to impact upon health at the individual level. It does through policies like tobacco control policy or genetic drugs, for which India has become famous world over. So these are the policy level interventions that come in, or controls on ultra processed foods, water, sanitation, all these are policy level instruments. Then it does it through systems. Now, how are health systems organized? How is primary care well connected to secondary and tertiary care? How are preventive programs being delivered at the primary care level? What is the kind of system created for that kind of delivery? All of these are important system level issues. Then you have actual program design and delivery. Then you have community engagement, active community participation. All of these are elements of public health. So public health is not just water and sanitation, though they are very, very important. But it actually embraces a whole array of services and therefore has to bring in a wide array of disciplines in order to create the knowledge pool that can be translated into multisectoral action. So it was with that aspiration that we started the Public Health Foundation of India in 2006. The first idea was to start two schools of public health, one in the north and one in the south. And Hyderabad was identified as one of the first institutions, but it took a while because of a variety of challenges that we had in terms of the land allocation being challenged in the court and so on. But finally we overcome that, and now the permanent campus is being created. But from 2008 onwards, our institute has been functioning from a temporary campus, has been delivering a variety of educational programs, training programs, engaging in high quality research, which has been recognized worldwide. And it has also been working with several governments in the region in order to provide a lot of technical support. So we are proud of what the institute could achieve even from the temporary campus, but we are confident that this will provide us an opportunity to grow the institute faster and further so that they can actually function much better. The foundation itself has about 5.5 institutes, if I may say so. We have institutes in the National Capital Region in Gurgaon, which is called the Indian Institute of Public Health in Delhi. Our Indian Institute of Public Health in Gandhinagar has a beautiful permanent campus on the banks of the Sabarmati River, and it has acquired a university status. It is capable of delivering its own degrees because it's empowered by a state legislation. We have also in Bhubaneswar, as well as in Shillong, other institutions. And we have an ancillary campus in Bengaluru, which the government of Karnataka allotted in terms of government buildings and is anxious to have an independent institute of public health over there. So we probably will have about 6. But our footprint is there across all the states of India in terms of educational programs, training programs, research programs, and in support to governments in a variety of programs that we engage with in terms of providing technical support, not only to governments but also to civil society partners. Just to give you a little idea of what PHFI has achieved over the years in terms of capacity building, it will be helpful to recite a few numbers. we have, through these facilities, trained 2,300 public health professionals through 11 on-campus programs, 7,100 through e-learning programs across 20 courses, 19,000 professionals have been trained in short courses, 36,000 primary care physicians have been trained through award-winning certificate courses. Primary care physicians initially from the private sector, but now with 12 state governments are being trained in a variety of health conditions for early diagnosis and effective management. And these have now been extended to 31 countries in partnership with the research information systems of the Ministry of External Affairs during the COVID period, where we have been working with countries in South Asia, Southeast Asia, and Africa. And these have won the highest category of awards. They received the Platinum Award from the Quality Council of India, the highest category of skilling awards from CII, ASSOCHAM, PhD Chamber of Commerce, essentially to say that the quality of training has been well recognized by others, and we have been now partnering also with the American College of Cardiology for a global course in cardiovascular health. So we do have that kind of capacity in our training division as well as in our educational programs. In terms of research, we have had more than 3,900 scientific publications in reputed journals with an impact factor of 7. For those who are not familiar with the impact factor, anything more than 3 is considered world-class. We have an impact factor of 7 and growing. In 2021, the Web of Science, which is global, has awarded the Clarivate Award in 2021 for excellence in research to Public Health Foundation of India for medicine and public health. As the top research organization in India, with a citation level twice that of the global average. And we have partnership with over 80 reputed academic institutions worldwide. Indeed, when we wanted for this Greenfield institution to be recognized as an institution of excellence by the government of India, when they opened up the campaign, I wrote to 40 internationally acclaimed institutions asking for letters of support. Within 1 week, we received 40 letters of support. Hopkins, Harvard, Emory, everywhere, from UK, all over the world. So that is the kind of academic strength we can bring to this institution. We were hampered to some extent by the lack of a permanent campus, but thanks to all of you, all to the benefactors who are assembled here, as well as the government of Telangana, now we have an opportunity to really grow this institution to its full potential and serve the state, serve the region, and serve the country to our best capacity while getting global recognition for our quality. And that is our ambition, to be regionally impactful, nationally influential, and globally respected. And I'm sure this institution can achieve that vision. But we do require support. And we recognize that public health is a bit amorphous entity. People do not recognize the beneficiaries of public health straight away. Because in a clinical medicine, you know which patient is benefiting. In public health, the beneficiaries are nameless and faceless. But ultimately, we will have to strengthen public health if we want to prevent individuals from getting sick or very sick or being deprived of the needed health care by inefficient health systems. And that is why we require public health to be strengthened, both in terms of prevention as well as system strengthening, and in terms of right kind of policy development, whether it's universal health coverage or generic drugs or training non-physician health professionals and equipping them with technologies for functioning in primary health care. All of that is essentially a broader health system public health function. And unless we pay attention to that, we will not succeed in limiting the numbers of people who are going to get desperately sick and will be seeking health care which may or may not be available. So that's why we believe that public health institutions are very important. And for this state, this region, and this country, this is one of the highest priorities as we pursue our development. And we have seen that with all our aspirations for economic growth, if we keep on getting public health failures, they will be the banana skins on which the economy will keep slipping. That has happened in India, that has happened in global economy. We have seen that during COVID. Therefore, we need to have an efficient, equitable, and empathetic health system functioning very well in the steady state if we have to create a strong, swift, and sustained response to a public health emergency when it comes. And if we do not create those systems now, we will continue to have challenges from public health emergencies. Some other pandemic will come, or some other public health emergency will come. Even it may be a natural disaster due to climate change. We need to create robust systems for that. We need to create the individuals for that. India is doing remarkably well in terms of technology development, and Hyderabad is one of the nerve centers for that. And I'm sure there are health technologies that will be developed which are going to be very useful. In fact, our own institute here in Hyderabad has developed a number of commendable technologies for healthcare, for primary healthcare. But without an adequately trained health workforce, all the investments in infrastructure will be a carriage without wheels, and all the health technologies that we develop will be non-performing assets. Therefore, we do need to train a very large number of health professionals, right from allied health professionals to public health professionals, as well as training doctors and nurses who are in the system to take better care of the diseases that people do have. And therefore, the aspiration of this institution is to grow to a university which is capable of starting more courses, possibly a BSc in public health as well for undergraduates, a training institution for allied health professionals. I believe that there is a broad band of expertise that we need to create, and this institution has the potential and promise to do that, provided you support us. Thank you very much.
Future university. ఇక్కడ ఉన్నాం టెంపరీ దాంట్లో ఉన్నాం. దిస్ ఇస్ ఎ టెంపరీ బిల్డింగ్. It'll have to be same as our ISB, like the same. It will be in the same stage level. This will be better. Global. Like ISB with a lot of ఇక్కడ 40 including our general supporting us. Yeah, 40 where we are standing, that is
temporary, sir. This is our permanent campus. Spread out all the 43 acres.
Yes, sir. Yes, sir. Agreement.
And this is the Musi, sir.
Musi. Thank you.
And this is Valantari. That is the outer ring. And you have seen the sign also over there. You can
I would like to request the cooperation of all the guests during the course of the event today. And please switch your mobile to the silent mode to avoid any interruptions. IIPH campus and new academic block 1. I'm Dr. Gauri Iyer, faculty here at IIPH, and I will be the MC for today's event. And it is with great pleasure that I welcome all of you, all the distinguished guests here today on behalf of IIPH Hyderabad. Our Honorable Minister, Sri Harish Gaur Garu, our MLA, Prakash Gaur Garu, our Chairman of the Board, Mr. Srini Raju, our President, PHFI President, Dr. Srinath Reddy, our board members, Ms. Mahima Datla, Mr. Hari Bugana, Dr. Madhu Mohan, Dr. G.N. Rao, Dr. G.V. Prasad, Sri Rajiv Sharma Garu, and all the other, Varaprasad Garu, how could I forget? Yes, and all the other distinguished guests. In addition, I would like to extend a warm welcome to the press and the media, and all the guests here today to the inaugural function. So I would now like to invite some of the guests to the dais. Would like to actually invite, some of the guests to the dais. Our Honorable Minister, Harish Rao Garu. Yeah. Our MLA Prakash Gaur Garu. Oh, sorry, Andy, my bad. Okay. Please, Randy. So anyway, welcome to the MLA Garu, Andy. Sorry, me peru tappu cheppanu meer karandi. Yeah. Okay. Yeah. The chairman of our board, Mr. Srini Raju Garu, please, sir. Dr. Srinath Reddy, President of PHFI.
Excuse me, divisional president here, Dharma Reddy. Divisional president here.
Uchara?
Uchara.
Okay.
Dharma Reddy.
Yeah. Mr. I would also like to invite Sri Rajiv Sharma Garu to the dais, who is the Chief Advisor to the Government of Telangana. Thank you, sir. And we'd also like to invite Ms. Mahima Datla, who's the treasurer for the IIPH board and MD Biological Events. And Mr. Hari Bugana, who is the member secretary for the IIPH board.
Actually, he went for receiving the mail. Then he'll come within 5 minutes. Dharma Reddy.
Okay. Yeah. Thank you all again. I would now like to request the minister and the other dignitaries on the stage to light the lamp before we commence with the welcome address. ఒక చైర్ పెట్టారా చైర్ పెట్టిన తర్వాత పిలుస్తాను పెట్టారా ఓకే I would like to invite Prakash Gaud Garu, our MLA, to also come onto the dais and grace us with his presence. No, one more. Division President Dharma Reddy. ఆయన కూడా కూర్చుంటారు అక్కడ ఎవరు చెప్పారు యా Yeah. Thank you for lighting the lamp and starting off this morning's occasion on this auspicious note. I would now like to request our Institute Director, Dr. GVS Murthy, to give the welcome address.
Thank you very much, Gauri. Thank you for this opportunity to formally welcome all the guests who are here. For us, it's a big event because in this part of the country, Grah Pravesham, in the north, Grah Pravesh, or if you look at Urdu, Dawat, Takmeel, Tamer, all these are very important because the first time you move into your owned house is the pleasure which is undefined. And therefore, when we move here, that is the joy and the thrill of moving into your own home. And the office of the home is exactly the same because here we spend 8 to 10 hours every day. I think one word which describes an inaugural beginning is the Urdu term ibtida. And this actually describes not just a Grah Pravesh, the beginning of a new chapter. And what we are witnessing here is actually the beginning of a new chapter. The journey has not been easy for us. For 14 years, just like Ram, we were in Banvas. 2008, we were supposed to move here. Took us 14 years to come into the forests of Ayodhya here. And therefore, the thrill and joy is even much more. It is an honor and privilege to welcome Sri T. Harish Rao Garu, the Minister of Finance, Health and Family Welfare Government of Telangana, who has the credit of redefining happiness on the face of farmers in Telangana with Mission Bhagiratha. And what we would want is the other half, the quality of life of people of Telangana, the Awam of Telangana, to benefit from his health cap, and therefore the success of Mission Bhagiratha to be translated into improving health care. And we are with you, sir. तिजोरी की चाबी आपके हाथ में है, सर, और तेलंगाना की आवाम की बेहतर स्वास्थ्य भी आपके हाथ में है, और हम आपके साथ चलने के लिए तैयार हैं. We assure you, sir, that we'll walk with you to the last mile to improve the health status of our people in Telangana. This is just the beginning, what you're seeing here, but with our board, the Institute of Public Health Sciences Board, we want to go much further, going on to a university status, so that we can provide the necessary evidence, research evidence, to the government to make a difference to the programs that are being implemented, as well as build capacity and skills for the people of Telangana. Sir, आपको याद होगा आइडिया क्लिनिक्स के इवेंट पे हरीश राव सर आपको याद होगा आइडिया क्लिनिक्स के इनॉग्रेशन में भी आए थे, और मैंने आपको गोवा का डायबिटिक मैनेजमेंट के बारे में आपको एक एग्जाम्पल दिया था, गोवा मॉडल ऑफ डायबिटीज़ केयर. सो उसी तरह से सर इन ऑल फील्ड्स ऑफ हेल्थ केयर हम आपके साथ हैं, एंड वी विल प्रोवाइड दैट सपोर्ट टू इम्प्रूव द फैसिलिटीज़ as well as the capacities and the health status of people of Telangana. I welcome our MLA Garu and Prakash Garu and Sri Rajiv Sharma ji, the Chief Advisor to the Government of Telangana. It's a great honor to have you here on the dais, sir. Moving to the board, just like to give a very brief welcome to the different board members. Dr. Srinath Reddy Garu, the Telugu Bidda, who did the nation and the globe proud. A visionary beyond compare who has given a fillip to public health practice across the globe. Sri Sriniraj Garu is a phenomenal institution builder. Triple IT, ISB are examples living in this city, and we now look at his benefit to IIPH and build this institution. Haribuganna Garu, a financial wizard and management expert, brings in those twin objectives into the functioning of our institute. Mahima Datla Garu, whose life mission is to prevent deaths by providing affordable made in India vaccines. And today, Biological E is right at the forefront. Welcome you, ma'am. Madhumohan Garu, a serial entrepreneur, and this is a term I have coined, because wherever he puts his hand, like the hand of Midas, it turns into gold. A physician par excellence, but we want the Midas touch to make the difference. G.V. Prasad Garu, a pioneer in health and innovation, and has personally mentored thousands of people with innovations to bring them to successful examples. Dr. G.N. Rao Garu, who took up the gauntlet of eliminating avoidable blindness in this region and set up the very first WHO collaborative center on prevention of blindness in this part of the country. It is also a pleasure to welcome dignitaries like Varprasad Garu, Govind Hari Garu, Dr. Ranga Reddy Garu, Dr. Vasireddy Garu, the other well-wishers and friends of IIPH. I also extend an extremely warm welcome to the staff and the students of IIPH who have worked so hard to make this event a successful event, and their spouses who have supported them and indirectly supported us by allowing them to be here. I need to make a special mention of Rohit Tiwari ji and Mr. Talaprada Srinivas Garu and the various vendors who work day and night. I welcome you all to look at the fruits of your labor and welcome to the media to enjoy the fruits of our labor. Thank you once again to be here. Welcome you all with a very warm heart.
Thank you, Dr. Murthy, for the really warm and gracious welcome. Peppered with many anecdotes. It's nice to actually, for all the young faculty and students to learn about get all this information. I would now like to request our President, PHFI, Dr. Srinath Reddy, to address the gathering today. Thank you.
Esteemed Minister, Sri Harish Rao Garu, other dignitaries on the dais, luminaries in the audience, faculty, students, and staff of IIPH Hyderabad, ladies and gentlemen. It is with the deepest gratitude to the government of Telangana that we mark this red letter day in the evolving history of the Public Health Foundation of India. Honorable Chief Minister Sri Chandrasekhar Rao Garu sanctified this land by performing the Bhumi Puja. He then announced a grant of rupees 10 crores, which set the campus construction in motion. Sir, we now have the honor of your presence to open the academic block to bring this campus to life. To give a brief history of PHFI, PHFI was founded in 2006 as a public-private initiative to build capacity in public health education, training, research, policy development, and program implementation. It was created to bring together the government, academia, civil society, and private sector, all key stakeholders for India's development, into a joint endeavor to strengthen India's health system. The effort was spurred by the recognition that India's health indicators were unfortunately lagging behind its economic growth. Sir, one of the key reasons for this was the lack of public health expertise at different levels: policy development, program design and delivery, monitoring and evaluation, as well as multi-sectoral alignment of policies and programs in other sectors to the objectives of advancing public health. Public health is a multidisciplinary pool of knowledge. It assembles knowledge from several disciplines for multi-sectoral application. While many countries, including several in Asia, including in our own neighborhood, Thailand and Bangladesh, have established schools of public health for several years and have reaped the benefits in terms of population health as well as in improving their health systems with better health indicators than India, unfortunately, we lag behind. Hence, the motivation for creation of the Public Health Foundation of India in 2006. Since then, PHFI has established 5 Indian Institutes of Public Health in Gandhinagar, Delhi, Hyderabad, Bhubaneswar, and Shillong, with an ancillary center in Bengaluru, which is also on the way to grow into an institution of public health. Sir, this is the second permanent campus after Gandhinagar, which has acquired a university status through a state legislation. This is what we aspire also for the Indian Institute of Public Health in Hyderabad, and we seek your blessings. in every one of our institutes elsewhere, as well as at the national level, our board has representatives from all the principal constituencies, that is the government, the civil society, academia, and also the private sector. As we now constitute our expanded board under the umbrella of the Indian Institute of Public Health Sciences, which is providing the overall governance of the Indian Institute of Public Health in Hyderabad, sir, we seek your advice on how best to bring the government much more actively into engagement. And we will be grateful, sir, if you nominate one of the senior officials of the health ministry at the secretary level or whichever level you feel appropriate to serve on the board. In some of our other institutes, we have also had the secretaries of finance and education to serve, but we leave that entirely to your judgment, sir. We believe that the government is absolutely critical if public health has to advance, and even if the Indian Institute of Public Health has to perform its mission with success, then your guidance is absolutely essential. Through our IIPHS, we offer diplomas, masters, and PhD level courses and a variety of training programs. Just to briefly enumerate our record so far, we have trained 2,300 public health professionals through 11 on-campus programs. We have also provided e-learning programs across 20 courses to 7,100 public health trainees. We have also, in short courses, trained 19,000 more professionals. And, sir, since primary care is absolutely pivotal for the health system and is the foundational basis of an efficient, empathetic, and equitable health system, and primary care has unfortunately been neglected, both in rural areas through under-resourcing and in urban areas through lack of planning. We believe that primary care physicians need to be trained both in the government sector as well as in the private sector. We have trained 36,000 primary care physicians through award-winning certificate courses, and these include nominees from 12 state governments. We are running in partnership with 12 state governments for training the physicians in their health services. In terms of, and they have proved invaluable. The alumni of these courses have proved invaluable during the COVID period, have rendered yeoman service, and have been recognized by awards by many state governments for the nature of their contributions. In terms of research, which is policy and program relevant, we have had 3,900 scientific publications in reputed journals with a very high impact factor, which puts us in the world class. Indeed, we received the Web of Science Clarivate Award for 2021 for excellence in research in India in medicine and health, with our citations being twice the global average. We have partnership with over 80 reputed academic institutions worldwide. Sir, when we wanted this particular institution to be considered by the government of India as an institution of excellence, we wrote to 40 leading academic institutions across the world seeking their support. Within 1 week, we received letters from all 40, from United States, from UK, Canada, Australia, New Zealand, Asia, Africa, everywhere. And that is the strength we can bring to this institution, sir. Sir, we partner with 12 state governments, as I said, to assist in training their doctors and nurses. In Haryana, we partnered with the state government and Deloitte, again, a partnership for a public purpose, not just an ordinary PPP, which is a public-private partnership, but we redefined PPP as a partnership for public purpose. So Deloitte, Government of Haryana, and PHFI. Together, we had a program in the district of Karnal, where during the second wave, when the rest of the country was suffering severe hardships, by providing a model of home-based care with frontline health workers who are technology-enabled, supported by telehealth services from the neighboring medical colleges, we have demonstrated a marked reduction not only in hospitalization, but also in mortality. And recently, we have also partnered with the government of Haryana and Deloitte to design and deliver a highly impactful program for correction of anemia in the Rohtak district. These are the kind of skills and talent and commitment that we can bring to the state of Telangana, sir, as we expand this institution and dedicate it to the people of Telangana. Sir, the Indian Institute of Public Health in Hyderabad is already a leader in several areas, especially in disability care. It has developed a remarkable array of health technologies for primary care. And now it intends to grow with the creation of 5 centers of excellence in infectious diseases, maternal and child health, non-communicable diseases, in mental health and disabilities, as well as in environmental health, ranging from climate change to air pollution and other environmental challenges, including, of course, water and sanitation. Sir, Iiph Hyderabad is now stands ready to serve the state of Telangana with renewed vigor and enhanced capacity. We will be ready to assist in implementing your vision of invigorating primary care, strengthening district health systems, improving health information systems and data analytics, as well as the delivery of programs. It is part of the national health policy, sir, that we must have a public health cadre and a health management cadre. PHFI and the Indian Institute of Public Health, Hyderabad, were among the first in the country to start a diploma in public health management for the National Health Mission since 2008. And we also partner a number of other institutions and enable them to do that. Therefore, we were preparing ourselves for this particular development. And now, if the state of Telangana would like to institute these cadres, we are ready to assist you, sir, in creating these very essential cadres. Your vision will become our mission. I would like to also say that if we get a university status, we'll be able to initiate a number of new courses. We'll be able to start a BSc in public health, training a large number of people in undergraduate courses in public health who can be positioned in community health service centers for delivering public health services as well as essential primary care. We will be able to train a large number of allied health professionals. The entire health workforce of Telangana will get invigorated in terms of numbers as well as skills and certainly motivation to serve the community. I believe, sir, that we owe a lot to the government of Telangana for the support that you have provided thus far, and we look forward to further support and guidance from you. But I would also like at this point in time to acknowledge the support from our board, which has really been very helpful in ensuring that we transit from a temporary campus to this excellent permanent campus in this beautiful surroundings. We would like to thank Mr. T. Srinivas, who really designed and created this campus with great skill, and Mr. Rohit Tiwari, who has been the live wire behind electrifying this whole campus with his energy and making sure that this happens and arranging this function. Sir, as we grow with the plans to start these 5 centers of excellence, I'm sure we'll be able to attain our potential much better. మీ ఆశీస్సులతో దినదిన ప్రవర్ధమానమై ఈ క్యాంపస్ పెరుగుతూ విజ్ఞాన విజ్ఞాన సంపదలతో వర్ధిల్లాలని మా ఆకాంక్ష. మీరు ఈరోజు వెలిగించిన ఆ దీపం తెలంగాణకే కాదు పూర్తి దేశానికే ఆరోగ్య కాంతి అందించాలని మా అభిలాష. Esteemed Minister, we pledge to place the energy and expertise of Iiph Hyderabad and the whole of PHFI across this country to serve the people of Telangana through the knowledge and skills required for transformation of the health system. Even as we will strive to make IIPH Hyderabad to make it a global leader in public health, we will dedicate ourselves as foot soldiers to support your movement to create a Tandurust Telangana, which will be an example for all other states of India across all health indicators. We need your blessing, sir, and a booster dose of the government support. Thank you.
Thank you, Dr. Reddy, for the eloquently actually highlighting the need for public health and the role of the government with our institute. And in your inimitable style, with your usual wit and humor, you continue to inspire and have inspired all of us to join the cause of public health. Thank you again for your address. I would now like to request Mr. Srinivas Rajagaru to address the gathering. Mr. Srini Raju is chairman of our IIPH board, is a well-known entrepreneur and a private equity investor. In addition to that, he's deeply committed and passionate about higher education in India and has been actively involved in building and governance of several educational institutions of higher learning, like the IIIT, ISB, Kriya University, etc. I would like to request Srini Rajagaru to say a few words. Thank you.
Honorable Minister T. Harish Rao Garu, my colleagues on the board, patrons, the faculty, students, and all the invited guests, a very good morning to all of you. Very often we get asked this question saying that, are you owned by Government of India? We said no. Are you owned by Government of Telangana? We said no. Then who owns it? It's a very interesting thing. A lot of people have difficulty in comprehending a model that we built 25 years ago. I want to acknowledge the director of IIIT who is sitting here. And it's like a group of people from our community here coming together, contributing money, effort, and the government supporting us through land and at times through grants kind of thing. We created a real public institution. For us, we understand the government institutions, we understand the family-supported, trust-supported institutions, but the institutions that are basically started by the community at large are very few. So for a very long time, even the Government of India did not know where to slot us. So when we go to them saying, are you private? We said no. Are you government? We said no. Then what are you? We said, we're a public institution. Started by the public, for the nation. So that is what this one is. So some of us who have been part of it, been earlier also part of IIIT Hyderabad, which was started about 25 years ago. Today it's considered to be one of the best in the country and one of the leading research institution just here in our Hyderabad city. The next one is Indian School of Business, same thing. There is some common people across these institutions. Thanks to the people from the other cities, they have brought in a lot of money and other resources, created a world-class institution. It's rated as a #1 from India in somewhere in the ranks of 20s in the world. And I would like to acknowledge the Dean of ISB who's here, Mr. Madan Pillotla. PJ Narayanan is there, is the director of it. So when I approached the leadership of the state, said that we would like to take this University of Public Health forward. The only question that was asked to me is that, will it be as good as IIIT and ISB? My answer to them is, it will be better. And better because we have the support of 40 plus the leading institutions in the world. Anybody we ask for, thanks to Professor Srinath Reddy's relationships with them, they were already there to help us. It is us who are actually leading a little bit behind them. And now recently another probably the the top 1 or 2 universities of the world in public health came forward to establish a center here. So we just started this one, and then the COVID came in. Things did not move as much as we expected, but now with the support of the board members and the patrons, I would like to acknowledge there's quite a few of them. I'm not saying everything, but my big brother Varprasad Reddy garu is here, and there are a lot of other patrons there. And with the help of the people within Hyderabad, in Telangana, and across the country, and from the US, we have ever relentless Dr. Madhu Mohan garu is here from Washington, DC. I want to acknowledge his, everybody contributed, but want to say that he wakes us up every day in the morning and say, follow us up from there. Are you guys on, working or not? So we're all here, and because we have other responsibilities, we tend to sometimes slow down and little delay the things, but he doesn't leave us. So Dr. Madhu Mohan garu, I said it in private, today I want to acknowledge in public that, but for you that, we would not be moving as fast as, we are moving today. Thank you very much. And, for all of us, the leading light, Dr. G.N. Rao garu, very, very few people know of him. He is the first one to build a real public institution in this city, and a leading institution in the world. Yes, ISBs, IIITs, they are there, but in healthcare, he's built very quietly one of the best institutions from here. And it's, I'm repeating it, it's a truly public institution. He's the one who built it, his name doesn't appear anywhere there. Sir, we always take inspiration from you. Okay. So I will not like much time now with the support of all of you from different parts of, whether from academics, research, the people who volunteer time for us, and the patrons who support us with money and time. We thank you all for the support so far, and we look forward to your support in future also to build a great institution from our great city. Thank you very much.
Thank you, Mr. Sriniraju garu, for your address. And now I would like to invite our Minister, Shri Harish Rao garu, our Honorable Minister of Finance.
గౌరవనీయులు శ్రీనాథ్ రెడ్డి గారికి, సినీ రాజు గారికి, రాజీవ్ శర్మ గారికి, స్థానిక శాసనసభ్యులు ప్రకాష్ గౌడ్ గారికి, మహిమా దాట్లా గారికి, గద్వాల్ ఎమ్మెల్యే కృష్ణమోహన్ రెడ్డి గారికి, స్థానిక కార్పొరేటర్ అర్చన గారికి, హరి బుగ్గన గారికి, మరి చాలామంది అందరూ వివిఐపీలే ఉన్నారు, అండ్ ఆల్ ద డిగ్నిటరీస్, అందరికీ పేరు పేరున నమస్కారం. చాలా సంతోషం, ఇండియన్ ఇన్స్టిట్యూట్ ఆఫ్ పబ్లిక్ హెల్త్ మేనేజ్మెంట్లో ఇంత మంచి ఇన్స్టిట్యూట్ ఈరోజు హైదరాబాద్లో ప్రారంభం కావడం అనేటువంటిది నిజంగా చాలా అభినందనీయం, చాలా సంతోషమైనటువంటి విషయం. శ్రీనాథ్ రెడ్డి గారు ఒక మాట మాట్లాడుతూ, వీ నీడ్ ఎ బూస్టర్ డోస్ ఫ్రమ్ గవర్నమెంట్ అన్నారు. కానీ మీరు చైర్మన్గా ఉండడము, ఈ టీం మీరందరూ ఇన్స్టిట్యూట్కి ఉండడం, ఇది ఇట్స్ ఎ బూస్టర్ టు ద గవర్నమెంట్ ఆఫ్ తెలంగాణ అండ్ టు ద సిటీ ఆఫ్ హైదరాబాద్. సంవత్సరంలోనే ముఖ్యమంత్రి గారు దీన్ని గమనించి ఆ రోజుల్లో 45 ఎకరాల స్థలాన్ని 10 కోట్ల రూపాయలని ఈ ఇన్స్టిట్యూట్కి ఇవ్వడం అనేటువంటిది ఎంతో ముందు చూపుతో ముఖ్యమంత్రి గారు తీసుకున్న నిర్ణయం. ఆ రోజుల్లో కరోనాలు లేవు, ఇలాంటి ఎపిడమిక్స్ బ్రేకేజ్ ఎక్కడ కూడా లేదు. బట్ ఆ రోజుల్లోనే ఇట్లాంటి ఇన్స్టిట్యూట్ల యొక్క ఆవశ్యకతను ముఖ్యమంత్రి గారు గుర్తించి ఇంత మంచి స్థలాన్ని, డబ్బులను కూడా అందించి ఒక అద్భుతమైన ఇన్స్టిట్యూట్ రావాలని ముఖ్యమంత్రి గారు ఆకాంక్షించారు. నాకు ఆ సంపూర్ణమైన నమ్మకం ఉంది. అద్భుతమైనటువంటి టీం ఇక్కడ ఉంది. శ్రీనాథ్ రెడ్డి లాంటి వారు, సినీరాజు లాంటి వాళ్ళు దీంట్లో బాధ్యతలు తీసుకున్నారు కనుక తప్పకుండా వారు మాట అన్నారు శ్రీనాథ్ రెడ్డి గారు, మేము జాతీయ స్థాయిలో, రాష్ట్ర స్థాయిలో ఒక ఉత్తమ ఇన్స్టిట్యూట్గా దీన్ని తీర్చిదిద్దుతామన్నారు. ఐ హ్యావ్ ఆల్ కాన్ఫిడెన్స్ నేషనల్ లెవెల్లోనే కాదు ఇంటర్నేషనల్ లెవెల్లో కూడా ఇన్స్టిట్యూట్ అద్భుతంగా తీర్చిదిద్దబడగలుగుతుంది మీ నాయకత్వంలో అనేటువంటి నమ్మకం ఉంది. నిజానికి కరోనా తర్వాత యావత్ ప్రపంచమంతా కూడా సెన్సిటైజ్ అయింది. పబ్లిక్ హెల్త్ పర్సన్స్ యొక్క ఇంపార్టెన్సు, పబ్లిక్ హెల్త్ మేనేజ్మెంట్ యొక్క ఇంపార్టెన్స్ను మొత్తం గ్లోబ్ అంతా కూడా గుర్తించడం జరిగింది. నిజానికి మేము కూడా రాష్ట్ర ప్రభుత్వంలో అప్పుడప్పుడు మేము మానిటర్ చేసుకున్నప్పుడు మాకు మంచి ఎఫిషియెంట్ డాక్టర్స్ ఉన్నారు, మంచి టీమ్ ఆఫ్ హెల్త్ డిపార్ట్మెంట్ ఉంది, కానీ పబ్లిక్ హెల్త్ మేనేజ్మెంట్లో చాలా గ్యాప్ ఉన్నది. దర్ ఇస్ హ్యూజ్ గ్యాప్. అందుకే ఈ మధ్య మేము రివ్యూ చేసి అనుకున్నాము, ప్రతి హాస్పిటల్లో కూడా ఒక పబ్లిక్ హెల్త్ మేనేజ్మెంట్ పర్సన్ రిక్రూట్ చేయాలి అనేటువంటిది ఈ మధ్య ప్రభుత్వం ఒక నిర్ణయం తీసుకుంది. ఈ మే బి ఏ గుడ్ డాక్టర్, బట్ పబ్లిక్ హెల్త్ మేనేజ్మెంట్లో వాళ్ళకి ఎఫిషియన్సీ లేకపోవడం, ఆ గ్యాప్ అనేది మాకు వస్తూ ఉంది. అంటే ప్రైమరీ హెల్త్ కేర్ ఈజ్ ద మోస్ట్ ఇంపార్టెంట్. నార్మల్గా ప్రివెన్షన్ ఈజ్ బెటర్ దాన్ క్యూర్ అన్నట్టు పబ్లిక్ హెల్త్ మేనేజ్మెంట్ను మనం స్ట్రాంగ్గా వ్యవస్థను బలోపేతం చేయగలిగితే తప్పకుండా ఒక మంచి హెల్త్ కేర్ను మనం ప్రజలకు అందించగలుగుతాం. ఇవాళ భారతదేశంలో ఈ మధ్య నీతి ఆయోగ్ కానీ గవర్నమెంట్ ఆఫ్ ఇండియా కొన్ని ర్యాంకింగ్స్ ఇచ్చింది. ఇండియాలో బెస్ట్ పర్ఫార్మింగ్ స్టేట్స్ అన్నప్పుడు కేరళ మొదటి స్థానంలో ఉంటుంది, తమిళనాడు రెండవ స్థానంలో ఉంటుంది, తెలంగాణ రాష్ట్రం మూడో స్థానంలో ఉంటుంది. అయితే ఇక్కడ మనం గమనించాల్సింది ఏంటంటే, ఎక్కడైతే పబ్లిక్ హెల్త్ మేనేజ్మెంట్ స్ట్రాంగ్గా ఉందో, స్టేట్స్ లైక్ కేరళ, తమిళనాడు, వాళ్ళు పిహెచ్సి స్థాయిలో వాళ్ళ పబ్లిక్ హెల్త్ కేర్ చాలా ఎఫెక్టివ్ స్ట్రాంగ్ సిస్టమ్ వాళ్ళు డెవలప్ చేసినారు. అక్కడ ఆ స్టేట్స్లో పర్ఫార్మెన్స్ అనేది చాలా బాగా మనం చూడగలుగుతూ ఉన్నాం. అందువల్ల ఈ మధ్యకాలంలో తెలంగాణలో కూడా మేము ఈ పబ్లిక్ హెల్త్ మేనేజ్మెంట్ బాగా బలోపేతం చేస్తున్నాం. నిజానికి ఇప్పుడు నగరాలు పెరిగిపోయినాయి, దర్ ఇస్ ఎ హ్యూజ్ గ్యాప్. ఈ పట్టణ ప్రాంతాల్లో నగరాల్లో చూసినప్పుడు ఈ పబ్లిక్ హెల్త్ మేనేజ్మెంట్ అసలు లేకుండా పోయింది. గ్రామాల్లో చూస్తే ఆశా వర్కర్లో, ఏఎన్ఎంలో ఫర్ ఎవ్రీ 3000 పాపులేషన్ దెర్ ఇస్ ఎ సిస్టమ్. బట్ ఫర్ ఎ సిటీ లైక్ హైదరాబాద్ మనం 1 కోటి జనాభా దాటిపోయినాము. ఎప్పుడో పెట్టినటువంటి చిన్న చిన్న అర్బన్ ప్రైమరీ హెల్త్ సెంటర్స్ పెట్టి మేము వ్యాక్సినేషన్ చేయాలన్నా, కరోనా అవుట్ బ్రేక్ వచ్చినప్పుడు దీన్ని అడ్రస్ చేయాలంటే చాలా ప్రాబ్లం అయింది. ఆ సిస్టమ్ అనేది డెవలప్ కాలేదు. నగరం పెరుగుతూ పోయింది, దానికి అనుగుణంగా ఈ ప్రైమరీ హెల్త్ కేర్ అనేది మనం నగరాల్లో చేయలేకపోయినాం. అఫ్కోర్స్ ఇది దేశవ్యాప్తంగా అన్ని నగరాల్లో కూడా ఉంది, మన హైదరాబాద్లో కూడా ప్రాబ్లం ఉంది. దాన్ని గుర్తించి ఈ మధ్యకాలంలో ముఖ్యమంత్రి గారు ఒక 350 బస్తీ దవాఖానాలను ఈరోజు హైదరాబాద్లో తీసుకురావడం జరిగింది. ఎక్కడెక్కడైతే స్లమ్స్ ఉన్నాయో, బస్తీస్ ఉన్నాయో, దానికి ఇప్పుడు ఉన్నటువంటి సిస్టమ్కు ఒక 350 బస్తీ దవాఖానాలను ఈ పబ్లిక్ హెల్త్ సిస్టమ్ను ఇంకా స్ట్రెంథన్ చేయాలి, అవుట్ రీచ్ అనేది ఇంకా పెరగాలి అనేటువంటి ఉద్దేశంతో దాన్ని కూడా మన రాష్ట్రంలో తీసుకురావడం జరిగింది. అయితే ఈరోజు మేము పిహెచ్సి స్థాయిలో కూడా చూస్తే మాకు డాక్టర్లు, ఆశాలు, ఏఎన్ఎంలు ఉన్నారు, కానీ ఏదైనా అవుట్ బ్రేక్ అయినప్పుడు దాన్ని అనాలిసిస్ చేయడానికి, మేనేజ్మెంట్ చేయడానికి మాకు పర్సన్స్ లేరు. అందువల్లనే ఈ మధ్య మేము ఒక 15 ఫైనాన్స్ కమిషన్ నుంచి ఒక ప్రత్యేకమైన గ్రాంట్ వచ్చినప్పుడు మన రాష్ట్రంలో ఉండే 630 పిహెచ్సిల్లో ప్రతి పిహెచ్సిలో కూడా ఒక పబ్లిక్ హెల్త్ మేనేజ్మెంట్ పర్సన్ రిక్రూట్ చేయాలని చెప్పి ఈ మధ్యనే మేము ఒక నిర్ణయం కూడా తీసుకోవడం జరిగింది. సో త్వరలోనే ఆ దిశగా మేము వెళ్తూ ఉన్నాం. అంటే దీని ఇంపార్టెన్స్ను అన్ని ప్రభుత్వాలు గుర్తించినాయి. దెర్ ఇస్ ఎ నీడ్. ఎందుకంటే మనము రోగం వచ్చిన తర్వాత నయం చేయడం కంటే కూడా రాకుండా ఉండడానికి ఎప్పటికప్పుడు అనాలిసిస్ చేస్తూ, ఎప్పటికప్పుడు సిచ్యువేషన్ను అసెస్ చేస్తూ ఫాస్ట్ రిడ్రెసల్ సిస్టమ్ ఒకటి మనం డెవలప్ చేసుకోవాల్సిన అవసరం ఉంది. అందుకే మేము అన్ని పిహెచ్సిల్లో కూడా ఒక ఐటీ వింగ్ను, ఒక పబ్లిక్ హెల్త్ పర్సన్ను తీసుకొచ్చి ఇంకా దీన్ని సిస్టమ్ను బలోపేతం చేసే దిశగా ఈరోజు రాష్ట్ర ప్రభుత్వం ప్రయత్నం చేస్తూ ఉంది. అందుకే ఈసారి హెల్త్ బడ్జెట్ కూడా బాగా పెంచాం. మన రాష్ట్రంలో చూస్తే గతంలో 6,300 కోట్ల రూపాయలు హెల్త్ బడ్జెట్ ఉండేది. ఈ సంవత్సరం దాన్ని 11,440 కోట్లకు పెంచుకోవడం జరిగింది. ఇట్ ఈజ్ ఆల్మోస్ట్ 4.5% ఆఫ్ అవర్ బడ్జెట్. గవర్నమెంట్ ఆఫ్ ఇండియాలో చూస్తే హెల్త్ బడ్జెట్ వచ్చి ఇట్ ఈజ్ ఓన్లీ 1.1%. బడ్జెట్ మొత్తంలో గవర్నమెంట్ ఆఫ్ ఇండియా హెల్త్ సెక్టర్కి ఇచ్చింది 1.1 అయితే మన స్టేట్ గవర్నమెంట్ మన బడ్జెట్లో హెల్త్ డిపార్ట్మెంట్కి ఇచ్చింది 4.5% మేము బడ్జెట్లో పెట్టడం జరిగింది. అందుకే ఈ మధ్యకాలంలో కొత్త జిల్లాలు ఏర్పాటు చేసుకోవడంతో పాటు ప్రతి జిల్లాలో కూడా ఒక ప్రభుత్వ మెడికల్ కాలేజీని తీసుకొస్తా ఉన్నాం. అంటే గవర్నమెంట్ సిస్టమ్ని బాగా స్ట్రెంథెన్ చేయాలని చెప్పి రాష్ట్రం ఏర్పడ్డప్పుడు మన తెలంగాణ రాష్ట్రంలో 5 ప్రభుత్వ మెడికల్ కాలేజీలు ఉంటే ఈ విద్యా సంవత్సరం 17 ప్రభుత్వ మెడికల్ కాలేజీల్లో అడ్మిషన్స్ చేయబోతా ఉన్నాం. ఇన్ ద ఇయర్ 2014 మన రాష్ట్రంలో 850 ఎంబీబీఎస్ సీట్లు ప్రభుత్వ రంగంలో ఉంటే ఈ సంవత్సరం 1650 ఎంబీబీఎస్ సీట్లు ప్రభుత్వ రంగంలో అడ్మిషన్స్ చేయబోతా ఉన్నాం. రాబోయే రోజుల్లో 33 జిల్లాల్లో 33 ప్రభుత్వ మెడికల్ కాలేజీలు తేవాలని, అన్ని జిల్లాల్లో కూడా ఆర్టీపీసీఆర్ ల్యాబ్స్ తీసుకురావాలని, అన్ని జిల్లాల్లో డయాగ్నోస్టిక్ సెంటర్స్ తీసుకురావాలని, ఈ రకంగా పబ్లిక్ హెల్త్ సిస్టమ్ను బాగా స్ట్రెంథెన్ చేస్తూ గవర్నమెంట్ హెల్త్ సిస్టమ్ను కూడా స్ట్రెంథెన్ చేస్తూ ఉన్నాం. ముఖ్యంగా ఇంతకుముందు 3 టైర్ సిస్టమే ఉండేది. పిహెచ్సిలు, ఏరియా అండ్ డిస్ట్రిక్ట్ హాస్పిటల్స్, తర్వాత టీచింగ్ హాస్పిటల్సే ఉండేవి. మేము దాన్ని ఇప్పుడు 5 టైర్ సిస్టమ్కు మార్చాలనుకుంటున్నాం. గ్రామాల్లో పల్లె దవాఖానాలు, పట్టణాల్లో బస్తీ దవాఖానాలు తీసుకొచ్చి ప్రజలకు మరింత దగ్గరగా, అంటే ప్రిలిమినరీ దశలోనే వాళ్ళను గుర్తించి వారికి అవసరమైన వైద్యాన్ని అందించేటువంటి ప్రయత్నం. ఈ మధ్యకాలంలో చూస్తే మనకు క్యాన్సర్ కానీ అదర్ డిసీజెస్, కొన్ని క్రానిక్ డిసీజెస్ బాగా పెరిగిపోతూ ఉన్నాయి. అందుకోసం సూపర్ స్పెషాలిటీ సేవలు కూడా అందుబాటులోకి తేవాలని, ఇంకొకటి హయ్యర్ లెవెల్లో ఆఫ్టర్ టీచింగ్ హాస్పిటల్స్ ఈ సూపర్ స్పెషాలిటీ ఆసుపత్రులను అటు వరంగల్లో ఇటు హైదరాబాద్లో తీసుకురావడం కోసం కూడా ప్రభుత్వం నిర్ణయం తీసుకొని ముందుకు పోతూ ఉంది. సో ఒక 5 టైర్ సిస్టమ్ను మేము స్ట్రెంథెన్ చేస్తూ ముఖ్యంగా ప్రైమరీ హెల్త్ కేర్ మీద ఇంకా బాగా ఫోకస్గా మేము పనిచేయడం కోసం పనిచేస్తూ ఉన్నాం. దాంట్లో డెఫినెట్గా ఇందాక శ్రీనాథ్ రెడ్డి గారు అంటూ హర్యానాలో మేము రోహ్తక్ డిస్టిక్లో మేము పనిచేసాము, గవర్నమెంట్తో కలిసి పనిచేసినామన్నారు. తప్పకుండా రాబోయే రోజుల్లో తెలంగాణ ప్రభుత్వం కూడా మీతో ఒక అండర్స్టాండింగ్, ఒక ఎంఓయూ డెవలప్ చేసుకొని ఇంకా క్లోజ్గా టు ఇంప్రూవ్, టు స్ట్రెంగ్థెన్ ద పబ్లిక్ హెల్త్ సిస్టమ్ ఆఫ్ ద స్టేట్ మేము మీతో కలిసి పనిచేస్తాం. మీరు కోరినట్టుగా మా ప్రిన్సిపల్ సెక్రటరీ హెల్త్ను మీ బోర్డులో మెంబర్గా మేము వెంటనే ఆర్డర్స్ కూడా ఇచ్చి మీ బోర్డులో కూడా పెడతాం. సో ఇంకెవరిని పెట్టిన దానికంటే కూడా ప్రిన్సిపల్ సెక్రటరీ, హూ ఎవర్ ఈజ్ ద ప్రిన్సిపల్ సెక్రటరీ, ఇఫ్ హీ ఈజ్ ద సెక్రటరీ ఇన్ యువర్ బోర్డ్, డెఫినెట్గా అది ఈ ఇన్స్టిట్యూట్కు ఉపయోగపడుతుంది. అదేవిధంగా స్టేట్ హెల్త్ డిపార్ట్మెంట్కి కూడా ఎప్పటికప్పుడు మీ దగ్గర వస్తున్నటువంటి రీసెర్చ్ కానీ, మీ దగ్గర ఉన్నటువంటి పాలసీస్ కానీ, డెవలప్మెంట్ యాక్టివిటీని స్టేట్ కూడా దాన్ని అడాప్ట్ చేసుకొని మేము బెటర్ ప్రాక్టీసెస్ని ఇంప్లిమెంట్ చేసుకోవడానికి అది రాష్ట్రానికి కూడా ఉపయోగపడుతుంది. కనుక ప్రిన్సిపల్ సెక్రటరీ గారిని వెంటనే మీ బోర్డులో పెడుతూ మేము నిర్ణయం కూడా తీసుకొని ఉత్తర్వులు ఇస్తాం. ఇకపోతే ఇప్పుడే రాజీవ్ శర్మ గారు గుర్తు చేశారు, ఈ ఇన్స్టిట్యూట్తో నాకు 3 రకాల అనుబంధం ఉన్నది. రాజీవ్ శర్మ గారు గుర్తు చేసినారు. ఒకటేమో ఆ రోజు గతంలో నేను ఇరిగేషన్ మినిస్టర్గా ఉన్నప్పుడు పక్కనుండే వాలంటరీ వాజ్ పార్ట్ ఆఫ్ ఇరిగేషన్ డిపార్ట్మెంట్. సో అప్పుడు నేను 45 ఎకరాల స్థలం కావాలంటే 2-3 సార్లు నేను ఏదో క్వరీ రాశానట. సో రాజీవ్ శర్మ గారు ఇప్పుడు గుర్తు చేస్తున్నారు, మీరు ఆ రోజు కొంచెం వెనక ముందు అయినారు, ఈరోజు ఇది చాలా మంచి ఇన్స్టిట్యూట్ వచ్చింది అంటే నేను యాజ్ చీఫ్ సెక్రటరీ, వారు ఈ వాజ్ చీఫ్ సెక్రటరీ ఆఫ్ ద స్టేట్. సో సీఎం గారు అనౌన్స్ చేసిండ్రు మీరు ఇవ్వాలని నాతో 2-3 సార్లు వారు మాట్లాడారు. అప్పుడు వాలంటరీ వాజ్ పార్ట్ ఆఫ్ ఇరిగేషన్ డిపార్ట్మెంట్. టుడే ఐఎమ్ రియలైజింగ్, నిజంగా ఆ రోజు నాకు అవగాహన లేక నేను 45 ఎకరాలు ఎందుకు అని అనుకున్నాను, కానీ ఇంత అద్భుతమైనటువంటి నిర్ణయం మరి ఆ రోజు మన ముఖ్యమంత్రి గారు, చీఫ్ సెక్రటరీ గారు రాజీవ్ శర్మ గారు తీసుకోవడం, ఈ ఇన్స్టిట్యూట్ రావడం అనేటువంటిది నిజంగా చాలా సంతోషం. ఇకపోతే రాజుగారు ఏమన్నారంటే, ముఖ్యమంత్రి గారు 10 కోట్లు అనౌన్స్ చేసినారు, 5 కోట్లు విడుదలైనాయి, ఇంకొక 5 కోట్లు బ్యాలెన్స్ ఉందన్నారు. మరి ఫైనాన్స్ మినిస్టర్గా ఆ బాధ్యత కూడా నా మీదే ఉంది. తప్పకుండా ఈ ఫైనాన్షియల్ ఇయర్లో 5 కోట్ల రూపాయలు కూడా విడుదల చేస్తాం. ఇక శ్రీనాథ్ రెడ్డి గారేమో బోర్డులో మరి హెల్త్ డిపార్ట్మెంట్ నుంచి ఒక సీనియర్ ఆఫీసర్ని ఇవ్వమన్నారు. యాజ్ హెల్త్ మినిస్టర్ మా హెల్త్ సెక్రటరీని బోర్డులో నామినేట్ చేస్తూ కూడా నిర్ణయం తీసుకుంటాం. సో ఐఎమ్ వెరీ ఫార్చునేట్ అండ్ ఐఎమ్ సో హ్యాపీ టు బి పార్ట్ ఆఫ్ దిస్ ప్రోగ్రామ్ అండ్ ద డెవలప్మెంట్. చాలా చాలా సంతోషం. మరి ఇంకా ఈ ఇన్స్టిట్యూట్ ఒక యూనివర్సిటీగా రావాలనేది నా ఆకాంక్ష. మీరు ఈ మధ్య మేము కొన్ని ప్రైవేట్ యూనివర్సిటీస్ కూడా రాష్ట్ర ప్రభుత్వం త్రూ ఏ లెజిస్లేషన్ మేము ఇవ్వడం జరుగుతూ ఉంది. మీరు కూడా వెంటనే ఒక యూనివర్సిటీగా దీన్ని మీరు ప్రతిపాదించగలిగితే, అంటే ఇప్పుడు రైట్ నౌ మీరు హెల్త్ యూనివర్సిటీ కింద మీరు పనిచేస్తున్నారు, మనమే ఒక యూనివర్సిటీగా దీన్ని అప్గ్రేడ్ చేసుకోగలిగితే ఇంకా అంతర్జాతీయ స్థాయిలో అనేక యూనివర్సిటీస్తో మీరు టైఅప్ చేసుకొని ఇంకా బెస్ట్ ప్రాక్టీసెస్ను ఇంకా ఒక మంచి యూనివర్సిటీగా కూడా, ఎందుకంటే మంచి క్యాంపస్ ఉంది, మంచి ఇన్స్టిట్యూట్ ఉంది, మంచి టీం ఉంది, కనుక దీన్ని ఒక యూనివర్సిటీగా మీరు అప్గ్రేడ్ చేయగలిగితే బాగుంటుందని మీరు వెంటనే ఆ ప్రతిపాదన ప్రభుత్వానికి అందించినట్టయితే ముఖ్యమంత్రి గారి దృష్టికి తీసుకుపోయి దీన్ని ఒక యూనివర్సిటీగా కూడా తీర్చిదిద్దుకుందాం, దానికి అవసరమైన పూర్తి సహకారాన్ని కూడా అందిస్తానని చెప్పి మీ అందరికీ కూడా ఈ సందర్భంగా తెలియజేస్తూ, మరి అందరం అల్టిమేట్గా అవర్ మిషన్, ఇటు ఇన్స్టిట్యూట్ అయినా రాష్ట్ర ప్రభుత్వం అయినా మనం అందరం కలిసి మన మిషన్ ఈ పబ్లిక్ హెల్త్ మేనేజ్మెంట్ను, ప్రైమరీ హెల్త్ కేర్ను బలోపేతం చేయడానికి తప్పకుండా అందరం కలిసి పనిచేద్దామని, ఆ దిశగా అందరం కలిసి ముందుకు సాగుదామని చెప్పి మనవి చేస్తూ, మరి ఈ ఇన్స్టిట్యూట్ని ఈరోజు ప్రారంభించుకున్నందుకు మీ అందరికీ శుభాకాంక్షలు.
Thank you, Harish Rao Garu. Actually, you didn't give me a chance to introduce you in the beginning, but I would say that we've heard so much about your dynamic and hands-on approach and taking on the health ministry, and we are seeing it in action where you not only talk the talk, but you're walking the talk in this very no-nonsense approach and with such grace and humility. Thank you, sir, for gracing us with your presence today. And being our chief guest, we couldn't have asked for a better suited person to set us on our journey for the next phase of our institute. Now, I would like to actually request Dr. Reddy to felicitate our minister and present a small token of our appreciation to Harish Rao Garu. If Dr. Yeah. Thank you, sir. Sir, you have to let us do our ceremony also, amigo. I think it's your grace that you have draped the shawl on Dr. Reddy, but I think, yeah. Oh, mine. No. I would now like to request Member Secretary of our IIPH board, Mr. Hari Bugana, to present the vote of thanks. During the welcome address, Dr. Murthy had actually talked about Mr. Bugana's financial genius in finance and equity. And I think one of the well-kept secrets that we didn't know and I discovered today is that he also donned a scientist's hat and has worked as a scientist for many years across several companies across the globe. I would now like to request Mr. Bugana to say a few words as in the vote of thanks. Thank you.
Thank you, Gauri. Words like wizard and all scare me, but thank you. On behalf of the Institute of Public Health Society and IIPH Hyderabad, I'm delighted to welcome all of you here, but also thank Honorable Minister Harish Rao Garu, who has set aside time from his very busy schedule, no doubt, and for all the distinguished guests who are assembled here, members of IIPH Society, patrons and friends of IIPH, thank you all for being present here today. So, many outstanding institutions have a modest start. And I think today is a very small step towards creating an outstanding world-renowned institution. The inauguration of this academic block and the R&D lab is a very small step, but we hope that with your support and your active participation, we will be able to realize the vision for this institution that was beautifully articulated by Professor Srinath Reddy Garu and supported by Honorable Minister Harish Rao Garu. So thank you all for being here today. But I'd like to end by saying something. We would not have been here today if not for the energy injected into this initiative by G.V. Prasad. True to his personality, he's very modest. He doesn't like the limelight. But, you know, actually one of my professors told me this. I went to thank him when I was graduating from business school, and he said, look, Hari, you know, you're like that wick in the lamp that we just lit. And the professor is like that stick that pushes the wick up so that it can burn brightly. So that's what G.V. Prasad has done. So thank you very much, Prasad, for being there. And I think lastly, 3 cheers to the team, IIPH here. Rohit, Srinivas unfortunately couldn't be here because of his illness, but they did an amazing job in about 6 weeks. Literally in 6 weeks they managed to get all of this together, so thank you all very much and looking forward to working with you all. So with that, Gauri, back to you.
Thank you, Hari Bugana Garu, and thank you, Minister Harish Rao Garu, for gracing us with your presence, and to all the other dignitaries